Autism and Down syndrome have often been mixed up a lot. And while both autism and Down syndrome are lifelong developmental conditions, they are entirely different. From the causes and symptoms to the different manifestations and treatment, here are the key differences between autism and Down syndrome. The first difference is obviously in the definition. Autism or autism spectrum disorder is a serious and complex neurobehavioral condition characterized by problems in interacting, speech, social, and motor skills. Autistic people look at others, hear, feel, and interact with other people in an entirely different manner. Now, Down syndrome or trisomy 21 is a genetic disorder which is triggered by the third copy of chromosome 21. People with Down syndrome show the mental equivalent of an 8 and 9-year-old. However, some individuals can lead a very normal life. The condition is usually characterized by delay in growth, a poor muscle tone, and a lower IQ. The second difference is in the cause. There is no single cause for autism, although there may be a genetic factor. It is mostly caused by certain abnormalities in the brain, like underlying medical conditions like phenylketonuria, the inability of the body to metabolize phenylalanine amino acid, viral infections of the pregnant mother, such as toxoplasmosis, that is passed on to the fetus, inflammation of the brain after birth, neurodevelopmental conditions of genetic origin that affect nerves and neurons, such as Fragile X syndrome and tuberous sclerosis, vaccines such as the influenza vaccine, to name a few. Now, Down syndrome is caused when abnormal cell division takes place and you get an extra full or partial copy of genetic material from chromosome 21. This extra chromosome causes issues as the brain and physical features develop. This disorder is not linked to anything in the external environment or anything that the parents did or did not do. The next difference is in the different types. There are three different types of autism spectrum disorders, namely autistic disorder, also known as classic autism, pervasive developmental disorder, also known as atypical autism, and Asperger's syndrome. Down syndrome also has three main types: trisomy 21, which is the most common type of Down syndrome, mosaic Down syndrome, where an individual has either two or three copies of the extra chromosome 21, and Robertsonian translocation that occurs with chromosomal rearrangements with improper fusing. The next difference is in the symptoms. Now, for autism, there are three main symptoms of autism. They are poor social interactions, impairment of communication, and restricted interests and repetitive behaviors. Others include abnormalities in eating or sleeping and seizures. The main symptoms of Down syndrome are poor mental capability, delayed speech, delayed movement, and impaired physical appearance with a flat face and slanting eyes. Other symptoms include a compromised immune system, hearing or vision problems, skin thickening, and obesity. The last difference is in the treatment. Although both conditions are not curable, they can be managed by medications and therapy. Medications used for autism include antidepressants, antipsychotics, and anticonvulsants. Other alternative treatments include the use of omega-3 fatty acids and vitamins. Treatment of Down syndrome involves medications such as piracetam and alternative therapy of speech, behavior, and exercise.